Hi, I'm Kolby, an instructor with St. John Ambulance, Alberta. Today what we're going to talk about is the steps you go through when you first come across an emergency scene or an injury or an accident. Doesn't matter what the injury is, you always go through the same few steps so that as a rescuer, you're prepared for what it is you need to do and what you're going to find. So one question we often get asked with first aid is, how are we supposed to know if somebody's hurt and how do we approach the casualty properly? One of the first things you want to do if you come across a situation and you think that somebody might be hurt is you need to stop and take charge. Take a deep breath, calm yourself down. Your heart's going to start beating faster, your breathing's going to speed up. You might be in an environment where there's some concerns around a traffic accident, things like that. If it's somebody you know, that emotional aspect is going to come in. What you don't want to do is panic. So take charge, take a deep breath, and then we want to try and take a look around, see if there's help around. Do we need to call out for help, get somebody over to us? We also want to look around for hazards. Is there anything around that we can see that might have hurt the casualty but could also hurt us? Don't focus on your casualty. Take a look around at the scene, up, down, all around. Make sure it's safe for you to even approach the casualty before you do that. Remember, you are the most important person in this situation because if something happens to you, you're not going to be able to help your casualty and you might need help yourself. We also want to try and determine what we call the history. By looking around, we can try and figure out how the casualty might have gotten hurt. Are they laying at the bottom of the steps? Are they laying next to a vehicle that might have hit them? Are they laying at the bottom of a ladder outside? Did you walk around the corner and find your spouse laying in the middle of the living room? We want to try and take a look around and see if we can figure out what might have happened. Once we've taken a look at the scene, we've looked for the hazards and we've called for help and we've tried to determine the history. What we want to do then is approach our casualty and see if they're responsive or not. That's going to be an important step in determining whether we need to call 911. We're going to walk up, we're going to tell the person we know first aid, and we're going to ask if we can help. Once you've done that, you want to assess responsiveness from your casualty. Did they respond at all? Are their eyes open? Are their eyes closed? If they don't respond to talk, then we want to see if they respond to touch. We're going to get down beside them, try and pinch the muscles up in the tops of their shoulders to see if they respond at all to pain. Pinch those muscles. If they don't respond right away, pinch a little bit harder because we want to see if their body reacts at all. Now, if they don't respond to talk and they don't respond to touch, that tells us that our casualty is unresponsive or unconscious. We need 911 for that. Being unconscious is always a medical emergency. So that's how we know for sure that we need to call an ambulance. So just to recap, the steps we want to go through when we're approaching a casualty is to stop, take charge, call out for help, look for hazards, try and determine the history, approach our casualty, identify ourselves, ask if we can help, and then determine if they're unresponsive. And if they're unresponsive, call 911. Remember, in an emergency, it's people like you that can do the greatest amount of good when you first come along a casualty. What we've just seen is a small piece of what you would find in a CPR course. To learn more, visit our website today.